Hi everyone, Felix here, Advanced Clinical Practitioner with Eden Clinic. Now, the complexities and nuances of pharmacology are not simple concepts. Over the next couple of videos, I hope to impart some knowledge on this subject in the context of testosterone replacement therapy, or TRT. Before we start, please bear in mind that pharmacology is an entire area of study in and of itself, so we won't be experts by the time we get to the end of these videos. However, hopefully it will allow us a little more understanding of the reasons as to why we often don't see instant results from medicines that we take. Fair warning everyone, there's some serious geekiness incoming. So, what is pharmacology? So pharmacology is the branch of medicine concerned with the uses, effects, and modes or mechanisms of actions of drugs. All that's great, but what do we want to know in the context of how we as patients utilize medications under the guidance of our responsible prescribing clinicians? The short answer is you don't really need to know as the patient or understand really, because that's what we as clinicians went to many years of extra school for, so that you don't have to worry about it. But I'm all for patients being informed. So if you do want to know, the first things we need to look at are two particularly important areas when it comes to medication use. And those are pharmacokinetics, which is essentially the movement of medications within the body, or more commonly referred to as what the body does to the drug. And then pharmacodynamics, which is the effects of such medications and their mechanisms of action, or MOA for short, which is also more commonly referred to as what the drug does to the body and essentially looks at plasma concentration and effect relationships. So, pharmacokinetics. Pharmacokinetics clinicians tend to remember this acronym ADME, or ADME, which stands for absorption, distribution, metabolism, and elimination. For pharmacodynamics, we look primarily at drug actions, such as drugs acting as agonists, drugs acting as antagonists, and drugs acting through ion channel mediation or DNA transcription. Now, straight away, right there, that just tells us that the way in which medications can affect our bodies and how our bodies affect them is very complicated. So what are agonist drugs? So agonist drugs act as agonists that generally bind to receptors and activate or increase a cell level response. Therefore, a drug that decreases or inhibits this action of an agonist is known as an antagonist. When we think about receptors that ligands, and ligands, by the way, are naturally occurring molecules that have the capability to bind to other molecules or receptors, or medications can bind to, we need to understand the principles of binding affinity and receptor occupancy. Now, these are very complicated concepts, but binding affinity, put very simply, is the strength of the interaction between a drug and its target site, and receptor occupancy is the measure of the degree to which that drug occupies the target receptor. Now, what receptors in the TRT community are we really interested in? Well, yeah, you've guessed it. Primarily, we like to gather together and wax lyrical about the androgen receptor mostly. I highly recommend you go and watch Man Medicine's YouTube channel's video on the androgen receptor. It's a big deep dive video, absolutely amazing. Then we also like to discuss the estrogen and progesterone receptors too, because they do play an important role. Now, the androgen receptor is the primary target of our main male androgen, which is, of course, testosterone. The other androgens of note in the steroidogenesis cascade are dihydrotestosterone, androstenedione, dihydroepiandrosterone, or more commonly referred to as DHEA. And for more information about the steroidogenesis cascade, please have a look at the video I did on that just here. So back to testosterone and the androgen receptor then. So the androgen receptor is a nuclear receptor. This means that when activated by an androgen, testosterone in this case, it translocates into the nucleus and acts as a transcription factor. Now remember earlier on we briefly mentioned mechanisms of action. This right here is an example of DNA transcription as the mechanism of action, or MOA. Now this is an exceptionally complex process that is very difficult to explain in simple terms. Essentially, multiple processes occur to change testosterone once it is bound to the androgen receptor. A portion of it gets changed into dihydrotestosterone, or DHT, and other estrogens, mainly 17-beta-estradiol. The androgen receptor is subject to something known as allosteric regulation, which involves the modulation of a ligand at the site of an enzyme and alters the said enzyme's activity. Wow, I think we'll stop there for part one, guys, as that was just getting a little too geeky, I think, for such a short, compressed space of time. And obviously, I'm just joking. There's no such thing as being too geeky. Knowledge is power. If you enjoyed the video, please hit that like and subscribe button, and make sure you hit that bell notification so you don't miss any of our uploads. And I'll see you in the next one, where I'll continue the discussion starting with the different types of estrogen.